Earlier today, CBS 4's Jim DeFede spoke with Congresswoman Donna Shalala about that and more regarding the coronavirus. Here's part of their conversation.
How prepared do you believe the federal government is to handle this crisis right now?
Well, let me say that we have first-rate physician scientists leading the efforts at the CDC, at the FDA, in the Public Health Service, at the NIH. They're now being coordinated for the first time by the White House, led by the Vice President, and he's just appointed a deputy, Deborah Birx. Colonel Birx, who holds the rank of ambassador, has been running the big AIDS program. She's an immunologist. She is first rate. So I'm very comfortable with who is leading it. The problem is that we have not been giving the resources to all of these agencies or to local governments and to state governments over a sustained period of time. In fact, we put in resources during emergencies, and then we start to cut them when we're not in emergencies. And so our infrastructure constantly has to be rebuilt as we deal with emergencies.
It seems as if even in the midst of the coronavirus spreading around the world, the president's budget still had major budget cuts, upwards of 20% budget cuts for the CDC, the NIH. Does that sort of show you a disconnect between how this administration should have been looking forward to this project?
Absolutely, but the Congress is not going to put up with that. Both Democrats and Republicans have made it very clear that we intend to provide supplemental funding, and we never intended to accept those cuts. But what is even more serious is the president is saying something different than his scientists. The one thing we have to do is to speak with one voice, and I think the administration is starting to pull that together. I wouldn't put the president in front of a camera to talk about science because in his last two appearances, he stepped all over the message and actually gave the American people the impression that this was going to somehow miraculously miss the United States, and that was the opposite of what the scientists were saying. We must listen to these scientists, physicians. They're world class. The rest of the world is listening to them. It's very important that political appointees step out of the way. I never spoke about the science. I always put these physician scientists in front of me, made sure that they had a clear message that they all agreed on, put them in their white coats, and let them talk to the American people.
Now, one of the things that you said, you have confidence in the number two person that will be directly under the vice president for this. Do you have confidence, though, in the vice president in terms of, although they're not calling him a czar, but in terms of leading this effort and also having all the messaging going through the vice president's office? Are you okay with that?
We'll see whether we're all okay with that. But look, everything's at stake. And Jim, this is a case where I think we should be very careful not to politicize this. We have to be supportive of both the leaders of the country, but in particular of these scientists, physicians that are going to lead us through this. This is not going to end in 6 months. We're in this for the long fun. We will not have a vaccine for 1 to 2 years, which means we're going to have drugs to treat the patients. We need hospital beds. We need diagnosis tests, and we need testing facilities all over the country. So I think this is a time when all Americans ought to pull together.